What does bone on bone mean on my osteoarthritis X-ray report? Imagine your joints as smooth, well-oiled hinges that move effortlessly. Now picture what happens when the lubrication wears thin and the parts start grinding against each other. That's what bone on bone really means in your X-ray report. When doctors see this phrase, they are talking about a stage of osteoarthritis where the cartilage that cushions your bones has worn away completely. In a healthy joint, the ends of your bones are covered with a soft, rubbery tissue called cartilage. This cartilage acts like a shock absorber and allows bones to slide smoothly over each other. On an X-ray, this cartilage isn't visible because it doesn't show up on the image. Instead, doctors look at the space between the bones. When the cartilage is healthy, there's a clear gap, showing the cushion that keeps the bones apart. As osteoarthritis advances, the cartilage gradually wears down. When it's almost gone, the space between the bones gets narrower. In the worst cases, the cartilage is completely gone, and the bones appear to touch on the X-ray. This is what is called bone on bone. It means the protective layer that normally prevents bones from rubbing directly against each other has disappeared. When the bones touch directly, it can cause pain, stiffness, and swelling. Moving the joint might feel rough or grinding because the bones are rubbing together. This stage often indicates more severe osteoarthritis, and it can make everyday activities more difficult. X-ray imaging is a key tool for diagnosing osteoarthritis because it shows these changes clearly. While it doesn't show the cartilage directly, the narrowing of the joint space is a good sign that cartilage loss has occurred. Other signs on the X-ray include bone spurs, which are extra bits of bone that form around the joint, and increased bone density under the cartilage, called subchondral sclerosis. These features help doctors confirm the diagnosis and understand how advanced the condition is. The phrase bone on bone isn't a formal medical term but is often used to describe this advanced stage. It's a sign that the joint has suffered significant damage. This information helps your healthcare provider decide on the best treatment options, which could include physical therapy, medications, injections, or even surgery like joint replacement. So, if your X-ray report mentions bone on bone, it means your cartilage has worn away to the point where your bones are almost or completely touching. This helps your doctor understand how much damage has occurred and guides the next steps in managing your osteoarthritis. If you have questions about what this means for your treatment, be sure to talk with your healthcare provider. They can explain your specific situation and options clearly.